All right, everyone. Just give another minute. I know people are just coming in, but welcome to the Transforming Crisis Response Cross Canadian Experience presentation. Again, I'll just give one more minute. Oh, awesome. Well, good morning for a few of you. Good afternoon for the others. My name is Robin Romano. I am a board member with Inform Canada and the CEO here at Distress Centre Calgary, and I'm joining us today from Calgary on Treaty 7 territory. I'm really excited that I get to introduce an amazing presentation today, one that I got to be a little bit of a part of back earlier this year with the Inform USA conference, but we kind of pulled me out and pulled some more colleagues in. And so what I'm really excited about today is we get to hear from colleagues across Canada in the 211 sphere, really talking about 211's role in transforming crisis response. And what's been really amazing about this work is that we've been doing pockets of it across different parts of the country and coming together to share, grow, and collaborate learning. So to have some national learnings with that local autonomy and local needs. And so this has really stemmed from our 211 Canada leadership table and a small community of practice that really started to say, what is 211's role? What is the role of information and referral in the crisis sphere, in the sphere of making sure that people are connected with the supports that they need to be able to thrive within their lives and within their community. And so today you'll get to hear some stories from the West, some stories from the East, and a little bit about how we're bringing some of those learnings together. So I'm going to hand it off to my amazing colleagues, Sarah, Angela, and John at some point will be jumping in. And I'll hand it over to you all and enjoy a great presentation. And if there's questions throughout, I'll be trying to monitor and watch the chat.
Great. Thanks, everybody. My name's Sarah Vardy. My pronouns are she, her. I'm the Special Projects and Initiatives Manager with Distress Centre Calgary. Just want to confirm that everybody can see the presentation main page as before we move forward.
It's good.
Thank you. And here we go. So as Robin mentioned, we're going to be discussing what crisis intervention, call diversion looks like in a few different contexts within Canada. So just a brief agenda of what we'll be going over today. And then I'm going to pass it over to Angela, if you don't mind, to give a little bit of that context piece before we get started in Calgary's crisis response.
Yes, thank you, Sarah. Hi, everyone. I'm Angela Finateri, and I'm the Director of Community Impact at Find Help Information 211 here in Toronto, and nice to see everyone today. So really what we're here today is just to talk about, as many of you have heard, that, there are different crisis response and there's different models that are happening throughout Canada. And we have, and what we're here to do today is really to talk to you about how all of, just how we've come together as a 211 service to respond to change within our communities. As you know, like right back in early 2020, there were cities across North America that were really impacted by the murder of George Floyd, and the Black Lives Matter movement began to take momentum. Municipalities began to look at how do we address the mental health issues, addictions, and what strategies and how do we connect with our communities and what is the best way to do it. So because of all that momentum and just what was happening within our own local communities, the municipalities began speaking to each other. In Toronto, there was a Safe Toronto or Safe TO strategy, which had community tables coming together, talking about, there are so many mental health crises and there's so many doors, but people really don't know who to connect and how do we look at an issue. And to be frank, it was even referred to as a pandemic within the pandemic, an epidemic within a pandemic. So I hope that our presentation today outlines how we've all taken a different approach, but at the end, we are all delivering a similar service, but with different approaches. So hopefully one of these approaches or one of our strategies will help create momentum in other parts of our country. Back to you, Sarah.
Thanks, Angela. So we're going to jump right into the Calgary model. On this main page, you can see the main partner agencies that are a part of the Crisis Diversion Project in Calgary. So that would be the Calgary Police Service, the City of Calgary Distress Center, which 211 operates out of in the lower half of Alberta, as well as Alpha House, which is a shelter and multi-service agency that also operates mobile teams here in Calgary. So kind of the starting point when we're talking about crisis diversion that we really prioritized when building out our partnerships and really kind of building a worldview in which we're all going to work together was creating a shared ethos between the partners about what we were trying to achieve. So these are the four pillars of that shared ethos that we all collectively worked together and agreed upon about what exactly we were trying to accomplish with this partnership with the tools that we have between the agencies. So we agreed that we were going to work together in partnership for social change, to take the stigma out of mental health and addictions, to offer the best services and support to Calgarians in crisis, and to help emergency responders do what they do best. We felt it was important to give a timeline. These projects take a lot of time. As you can see from our timeline, it was about 2 years of planning and work and consultation and other things happening between the agencies and within agencies before the work on the front line began. So starting in 2020, much aligned with the timelines Angela reviewed earlier in our presentation, the City of Calgary started engaging with community in a mental health and addiction strategy, and where our work comes in as 211 and partnering with the Distress Center of Calgary was in one of the focus areas of the city's overarching mental health strategy. So in 2021, what started as the Make the Right Call campaign, which was essentially an information and resource campaign about who to call for what between emergencies, when to call EMS, when to call fire, when to call police, and when to connect with an agency like Distress Center or 211 for resources or crisis support. That is also when the planning began about what crisis diversion was going to look as this specific project, this specific partnership began. And in 2022, in February, the work kind of began on the front line. We launched our co-location project, which is 211 staff sitting directly on the floor, taking calls right with the 911 call takers. It helped us build relationships between the folks taking the calls from 911 and the folks taking 211 calls, understanding what each other does and how we can work together. It started with one person, 2 shifts a day, and in July, of that same year, we were able to expand that to 24/7 operations, much like our regular 211 center. And then shortly after that, we worked with the city and with the Calgary Police Service to look at the police codes themselves so we could make amendments to what was possible within the 911 context. For folks who aren't aware, when you call 911, they have a series of codes. You might have heard them on television if you watched any police TV shows. That are kind of how things get coded so that they know the type of call that they're sending an officer to. And for a lot of them, if it's this type of call, send an officer. We were able to work with them to amend some of those so that things that were lower risk or there wasn't an immediate safety concern, there was the option of, instead of dispatching a police officer, the 911 call taker could connect that call over to 211 instead. So we will get into it on the next slide, I believe, about what exactly those codes were. But that happened, yeah, August of 2022. And then, so for one of the codes, and then another two in December of that year, we also were integrated directly into the Calgary Police non-emergency phone line in December of that year, which means when you call non-emergency, it's press 1 if you need this, press 2 if you need this, and 211 itself was added as a press 6 on the Calgary non-emergency line so that folks who aren't totally sure of exactly what kind of support they need hear a bit of information about 211 and can make that decision for themselves if 211 is feeling more appropriate in the moment when they initially had called non-emergency. Then in 2023, another mobile team partnership was launched to support a different area of the city. In August, we were able to increase the amount of staff up at 211 to facilitate receiving a higher volume of calls. And then we are really excited in February, almost exactly 2 years from when this project launched, we hit a really big milestone of receiving 10,000 diversions from 911 into 211, which is 10,000 911 calls that we were able to provide that resource crisis response on rather than a police response. And then just this month, we actually expanded our mobile response team partnership with Alpha House, who had been involved for the last 2 years, to expand the service area of our partnership to get more mobile response out into community. So we touched on some of this in the timeline, and I realize I misspoke. The police code amendments, there's a bit of detail here, but I'll get into it more later. But these are kind of the four main activities of the Calgary Crisis Diversion Response Project. The first being co-location. As I mentioned, we're right there on the 911 floor with those call takers, 24 hours a day, 7 days a week, 365 days a year. The next component is that police code amendment. So the three codes that we've so far worked on with the Calgary Police and with the City of Calgary related to unwanted guest calls, mental health calls, and suicide-related calls. The IVR prompt, which is that press 6 option when you call non-emergency police, and partnering with mobile teams so that we have an alternate to police response for folks in mental health crisis, for our unhoused neighbors in community to get the response they need. So yeah, that diversion response. So a bit more about those key police code related changes. The first is a code called unwanted guest, which is traditionally the type of call if there's a business owner who has somebody in the business who they perceive as not welcome there, outside their business, potentially on private property. But it's really a call where there isn't a medical or a criminal justice element necessarily, but it's just somewhere where somebody else would prefer them not be. So that's a code that we amended so that we could send a mobile response team that could offer a wider variety of services than the police officers are able to do to folks in that situation. Fun fact, that is the most highest volume of coded calls in the city of Calgary is that code. So being able to provide support around that and diverted response is a really big deal in the city of Calgary because that makes up a lot of police calls here. The next is folks in suicide crises. We were able to work with the city and police to amend that code. So those non-imminent risk suicide calls that come in through 911 or police non-emergency can potentially be connected over to 211. Because we're a distress center 211 hybrid, the staff are cross-trained both in crisis and suicide intervention and information and referral. So they provide that dual support over the phone, similar to what they can provide on mental health related calls. As long as there is no imminent risk to the person experiencing that crisis, they can potentially be connected with us instead of being dispatched to police. Those are not the only calls that are transferred to us from 911 to 211. 911 takes a lot of calls every year from folks that just aren't sure where to call. So they end up calling 911 or calling the non-emergency line when they have, say, a family conflict going on. Things like, my child is refusing to go to school. What do I do? If folks are potentially facing eviction and don't know what to do, or legal issues around like child protection or custody. So we see a lot of calls around a lot of different needs that folks end up connecting with 911, but are more appropriate for a 211 or information resource line. So these are some of the other common calls that we take from 911. This is my last slide, and then you'll be over in the capable hands of Angela to hear more about Toronto. But I just wanted to share a little bit about the success that we've seen, but also point out some trends that we've noticed, some patterns. So those little green arrows are things that I mentioned earlier in that timeline to kind of show this has been a phased approach, and we're constantly evolving the project to ensure that we're not plateauing and that we're always looking and thinking critically about the changes that we're making, as well as gauging the impacts. So that August of 2022 first arrow is when we put in that first code change, shortly after we moved to 24/7 coverage up at the 911 center, and it really did make a big difference both on the policy side and the relationship side. December of 2022, that second arrow is where we were integrated into the phone system itself, and it made a really big difference. In August of 23, we saw another jump when we did some of that expansion work. That's right around the time we were able to double our staff up on the 911 floor. So this really is a progressive approach, taking a looking at it from different angles, trying to resolve problems in an interdisciplinary way. So yeah, so far as of August, so last month, we're at just shy of 15,000 diversions, which we're incredibly proud of over here in Calgary. Thank you everybody for listening to this chat about Calgary, and I'm going to now pass it over to Angela, who will present about what Toronto has going on.
Thank you, Sarah. So in the Toronto crisis diversion, it's just slightly a little bit different than Calgary, and this is what we're talking about today. It's the different approaches that municipalities have taken. So in Toronto, when I talked a little bit about the timeline back in 2020, is that our response was really, it came out of Safety O, and it was a city-led response. So it was really the city of Toronto that led our response. And so you can see the response is called the Toronto Community Crisis Service. And all the people or all the anchor agencies are the Gerstein Crisis Center. We have Taboo, Two-Spirited People, and we have the Canadian Mental Health Association, along with Toronto Police Services and the 211 team. We are the diversion. So people who are experiencing mental health, they will call 211 for support, but we also have other channels that people can tap into to get the Toronto Community Crisis Service. So if you look at our, so moving over to our guiding principles, you will notice that when the Toronto Community Crisis Service was designed, it was to look at enabling multiple coordinated pathways of access. And what that really means in Toronto is that to access the Toronto Community Crisis Service, you can come through it by 911. You can also contact 211, as well as the community. So we have even the anchor agencies themselves make referrals into the Toronto Crisis Mobile Team for support. It's based on a harm reduction, trauma-informed care approach. The service itself is consent-based. So if you're 16 years of age and you are in need of mental health crisis support, as long as we have your consent, and consent happens at multiple levels. The consent can happen through 911 when someone is speaking to 911, or even when we do a dispatch, we always ask the individual in need of help if they are willing to consent to the service. It's client-centric, culturally related. We have the whole city is supported through an Indigenous crisis team. We also have the crisis workers themselves are part of various cultural. The diversity on the team is immense, and there has been a lot of training on all of our teams in terms of making sure that the service is culturally relevant and individual. But more importantly, one of the pillars is the accountability to service users and voices of those that have experienced the service. So we do have a report. There was a 6-month report, and there's a year report, and a 2-year report will come out shortly. But one of the things that the Toronto Community Crisis it's not a pilot anymore. I keep saying that because actually one of the slides will tell you that we're no longer a pilot, but the Toronto Community Crisis Service is through the Center of Addiction and Mental Health. They are our evaluator, and they have met with hundreds of individuals that have accessed the service and have provided feedback. And throughout the 6, 1 year, and even 2-year mark, all of the feedback that we've received we have taken and implemented to even grow the service, make the service better. So as we look at some of the guidelines or the timelines here, actually, I'm jumping up ahead. So I already talked a little bit about the slides. So our Toronto Community Crisis Service, it's 24/7. I talked about it being voluntary and client-based. It's for anyone 16 years of age. And there is no wrong door approach. And we also provide follow-ups. So that is one of the wraparound services, is that the individuals that have received crisis support, they are also asked if they would like to follow up to see how they're doing. And at that point also to look at, are there other services that, even though this is a temporary service, it's crisis in nature. However, sometimes people will call back. And so making sure that they are connected to community services is very important. And that's what the follow-up is all about. So when we look at Toronto's timeline, so as I discussed earlier, in 2020, this is when the whole momentum took place. And as a result, the City of Toronto began consultations. They did surveys. They had experts, as well as 33 community roundtables of everyone working together, looking at how can we address, crisis and mental health calls in our community. In 2021, through Safety, one of the recommendations was to have a crisis mobile response. And this is when 211 Find Help came into the discussions with the City of Toronto, whereby they looked at, they identified that they looked at where all the calls were coming in, mental health crisis calls to 911. And then based on those calls, which were about 30,000 each year, they looked at which communities had the most calls to 911 that were mental health related, that probably would have been better handled through a crisis response. This is where they came up with the 4 communities that were being served under the pilot. So that whole year, we began working with the city, with Toronto Police, and eventually the anchor agencies themselves to develop our model. And then in March of 2022, that we began a launch, and that launch was with the Gerstein mobile team. Then in April, Taibu mobile team, if anyone's familiar with Toronto, was located in Scarborough. So they are in the east end of the city. And then in July, the Canadian Mental Health Association, as well as the Two Spirited Peoples of the First Nation, also began supporting the city, the 4 pilot regions. After that, what happened, as I explained a little earlier, is that through the consultations and getting feedback, it was decided that the City of Toronto was going to expand the service. So as of last year, the pilot was then greenlit to become citywide. We did a soft launch in July, whereby our team began creating, we have dedicated, part of our navigation team are actually dedicated staff that do dispatch to the crisis mobile team. And just today, a few hours ago, our mayor has declared that, the Toronto Community Crisis Service is now a citywide service. And so we have all of our team that are eagerly awaiting, as you'll probably hear throughout the news, that it is become an official service of the City of Toronto. So this is where we are today. So when we look at how does someone access, or how does the response model work? So as I explained earlier, is you can have a caller. So the callers, you can see the 3 buckets, is they could either go from 911, then 911 determines that this is a crisis response. What they would then do is we have a backdoor number to them that they come into what we call to our crisis team. And our navigators then begin doing the whole, crisis intervention, and they begin to ask all the appropriate questions to make sure that the crisis team is something, is the response that they're looking for. Because sometimes they'll start with 911 and saying, yes, we want a crisis team, but then when they talk to our navigators, they may change their mind. So it could become that, we end up giving them a referral, but if not, then we would look at which community response or which crisis team would be the best response for them. But you can also call 211 directly. So when you call 211, if the navigators see that this is a call for, someone who is experiencing a mental health or a crisis situation, they will then offer the crisis team. So then that call comes directly to 211. But also some of our anchor agencies like the Gerstein, they've always had a crisis intervention and a crisis team. So sometimes the calls will go directly to them as well. So as you can see that accessing the crisis mobile team, there are various channels that you can get to the crisis mobile team, as well as those that are in, we have partnerships within the community. For example, we have a partnership with the Distress Center. So the Distress Center can also refer calls through for diversion as well. So so I've already spoken about who our crisis teams are. There's 4 of them, and they cover all parts of, well, Two-Spirit people, they cover the whole city. And then if we look at the map of the city, you'll see that the top half, top left, is covered by the Canadian Mental Health Association. The east part of the city is through Taibu. The light green is where the Gerstein Center, so they're primarily City of Toronto. And and then Two-Spirited people, they cover the entire city. So some of our common referrals. So apart from, referring individuals to the Toronto Crisis Team, we're also getting calls that are of emergency support for shelters. So accommodations and shelters made up 35% of our referrals. People looking for crisis stabilization support. So this is like looking for referrals that include food, family, counseling supports, youth services. That was 20% of our calls. Emergency medical support, 11% of referrals were made for emergency medical supports, as well as 10% of our referrals are directed to culturally relevant supports. Now, since we began the pilot, and today, actually, I ran these numbers up until the end of August, as I do not have September's data right now, but as of August, 15,939 unique calls were we actually dispatched or sent to the community crisis team. 78% of our calls received from 911 were responded with no police involvement. It takes about 13 minutes from a time that a call comes into 211 by the time a crisis team goes out. And if anyone knows about, just when you're working with 911, when you call 911, even within their system, they do have a triage system, whereby obviously calls of, that are threat, public safety calls, they are responded to immediately. Calls for someone who is in need of crisis or mental health support, they usually can take more than an hour. And so when you look at just having a crisis mobile team that's available and being able to, from the time of call to the time of dispatch, there's only 13 minutes. I mean, these are really incredible numbers, and something for all of us as a 211 service to be very proud of. And as I talked about, 56% of those that have been supported do accept a follow-up. So, and how they receive that follow-up is someone from the crisis team will go back out and see them and just connect with them to make sure that they are in a safe space now, that they've got the help that they needed, and if there's anything else that they need. Okay. I think now this is where, yeah. I believe is John. I think the second, it was here, we were going to lead into John. But I don't believe John is with us, or he was having some technical difficulties.
So I think yeah, hopefully we can share some information at a later date from John, but excited to kick off a little bit of a fireside discussion and a Q&A, Angela and Sarah, to be able to share some information and more, and hopefully lots of questions from those who are present. I think it was great to hear. I always love hearing about what's going on in both of the cities. One, because I'm very tied to the work here in Calgary. But a few years ago, as we were kicking off the work in Calgary, I got to travel with people from Calgary Police and the city of Calgary, actually to Toronto, where I got to spend a little bit of time with Angela and her team at 211, got to spend a little bit of time at the 911 Center in Toronto, and then got to spend a little bit of time with the Gearstein Center as well. So I feel like I've got to know quite a few of the Toronto partners. So really nice to see how initiatives, again, can start at different sides of the country, but be able to learn and really grow together, and really stemming from the same things that are going on in our community, with, again, that local autonomy piece. Sarah and Angela, I have a question for both of you to maybe kick it off and start us off. When we think about traditional training for I&R staff, system navigators, 211 staff, how did you have to change, adjust, transform any of the training processes and work that you did with staff at both centers to take on this new way of digging into I&R and working with partners in a different way?
Angela, do you want to go first? Or would you like me to go first?
Okay. You can go first so I can take a rest.
No problem. Yeah, so one of the things as a dual center that we prioritized, particularly when we kind of split off the teams in the initial phases, it was 211 folks that were rotating between our 211 services and our co-location services. But I think one of the things that we've really prioritized is that ensuring that folks are comfortable using their crisis skills as well as their I&R skills, and taking on that dual role while supporting these callers. In large part because the type of calls that we take are heavily related to mental health and suicide. As per the structure, as per the police codes we were changing. So I think working with staff to ensure that comfort level and clarifying the expectations around what exactly does information and referral services look like in this context, which is also a crisis response. So that, I would say, isn't necessarily a huge pivot, and we've for a long time prioritized that dual role within our center of crisis response and I&R, but it's something that our staff use at the same time on the same contact and are kind of oscillating between to provide that more contextual support that has been really important.
Yeah, and I think on our end, I think the first thing when Find Help, when we went into this initiative, I think a lot of our staff, they were really anxious and nervous. What does this mean? And we sat back and we just said, you're already getting these calls. Like at that point, 20% of the calls on 211 are mental health related. We're already diverting those calls to places like the Distress Center, the Gearstein Center. But really, a lot of those calls, we knew we could do more. And our team was always frustrated saying, well, we wish that there was something we could do, or, besides calling 911. So when we sat back, we looked at, okay, what training do we have? Crisis intervention is part of our accreditation, how to, looking at how to de-escalate a call is part of our accreditation, as part of the training. That's the training all staff receive. But what we did is we invested in doing more. We did assist training that we had already done but we did it again as a refresher. We also looked at trauma-informed care because, now when you're dealing with, crisis calls, a lot of times, the navigators are taking on all of that information that obviously sometimes sits with them. So looking at wellness, but then the City of Toronto actually took the lead in developing a training for everyone. So they did it for the crisis team, but they also did it for our navigators. So, mental health training in terms of, speaking with to individuals who are in different crises, and just the one-on-one about mental health and mental health supports. So we did a lot of refresher training. We also went to 911. A little bit different than what's happening in Calgary is that we're not co-located. So bringing our team to 911 and having, the city come in and look at how we do things, having a better understanding of our own processes, made it easier to understand how we were going to roll out the initiative. And similar to what happened in Calgary is really getting a lot of staff, navigators, insights and how we can support them in handling calls. But it was a lot of reassuring, really telling them that they had the skill sets and the training, but then obviously investing in more detailed training. And I think, and the last point that I was going to make in terms of the training was that overall it was from our team, it was really that understanding of that whole the accreditation piece and really helping them with that part.
I have another question to throw at you, and again, encouraging people to ask questions as well. So I'll ask one more. Chat's open, but then we'll throw it to others. We know in the work that we do in I&R, we partner with so many different organizations and so many different systems. Again, we're connectors. That's part of the work that we do. Can you share from your experience what some of the tips that you might have for starting to partner with crisis services, to partner with police, to partner with 911? Again, I think from a social service lens and social service providers, we come from some different backgrounds, philosophies, and trainings, but we're partnering with these different systems now to really create that transformational change for our communities. So if you could share just a little bit for people that are here that may be thinking of how do we start partnering in different ways, tips, techniques, tricks to get through that.
I don't know if there's any tricks or tips. I think so. Yeah, I really think that if you're going to get into into this type of work, it's to really understand the scope that it's not just from one angle. Like we're talking, it takes a lot of us as a team, a collective team of partners. So really that we all have to have that common goal. Like, what is it that we're trying to address and what role do each of us play in addressing? And so it was clear to us, because just in the Toronto model, Gerstein Crisis Mobile Team has been doing this work for a very long time. This is really what they've been doing. However, when you're looking at 15,000 calls a year and you're looking at working with a whole entire city, and when you're looking at providing services, is really we looked at how can we support that structure and how can we as a team come. So for example, having the Gerstein at the table with their years of experience and support in mental health. They were a great partner to develop with. So finding those champions within your partners and those that are doing the work, even Canadian Mental Health, they are another partner. All of our partners have been doing this work for a long time and really leaning on them for their support. And then knowing what was the role. We made it clear that 211, we were the front door. 211 is an easy to remember number. Anyone who's experienced mental health crisis, you could just call 211. But clearly our role was to ensure that we then provided that crisis diversion to those that actually do the work. And then clearly, working with police. How could we help police, and how could we support 911? Because a lot of 911 calls that they do get are not emergency medical. So taking those calls away. So it was really sitting down and developing a plan together and just looking at who were the right players. I would have to say, though, I have to give kudos to the City of Toronto because they led all that work. So for us, it was really coming to the table, and the city had already done a lot of that legwork. But I would just say that when we were together as partners, it was really all of us brought in our expertise and how we can support the system.
I would echo a lot of what Angela is saying. I think for our context, my biggest learning about what made this work and what made this sustainable was the relationships. It takes a lot of time to build those authentic relationships between the partners, especially when you do need to acknowledge the different worldviews coming in between a nonprofit crisis type service, I&R, with a city municipality, with a police service, with a mobile team shelter type organization. There's a lot of perspectives happening here. So early on in the slides about Calgary, we presented those shared ethos, and I think building those together, ensuring that despite any differences, we know what we're doing here. We know we want to work together. And I think building those authentic relationships early on really facilitated a sense of curiosity between people to understand where everybody's perspectives are coming in from and how we can work together. It really led to this place of shared learning. And I think I can confidently speak for a lot of the partners that we've all changed through this process, through the learnings that we've done together. So I would say that that's a really big tip. Just from my personal experience. I think also remembering that we're all learning together. This type of work is happening in different places, but it's for most of us, it's never happened like this in our context. So I think that commitment to learning and commitment to understanding what will and will not work in our context is really, really important. For me, I don't know what other tips I would have. I think also I've enjoyed that we've taken this like iterative approach and have not tried to do everything all at once, and really like we'll put something new in place, and then we will be in almost sometimes constant connection to understand what's working. Is there anything we need to resolve about it once it's in place, once everybody's feeling comfortable with any changes that we've made, then's the time to explore the next thing. That's really worked in Calgary.
Thanks, Sarah and Angela. Questions from anyone else? Open up to the floor. Well, we'll give it maybe one more minute, and maybe Sarah and Angela, I'll ask if no other questions come up, maybe ending on a little bit of a personal question is, what has this partnership and this work meant for you in your career as an I&R professional?
Wow. Robin, where do you come up with these? What does it mean? Okay, so for me personally, I would have to say, there have been so many highlights working with Find Help and 211. I have to say that this particular project initiative, even within our organization, actually, this was one project that I could say every person, every position in the organization at some point touched it. There's just a lot of, it's one of those projects and initiatives that they come in once in a lifetime. I would say at first when it was happening, it was overwhelming to think, can we do this? But then when you think about it, and what I was saying earlier, that personally, that we were already doing this, and we were doing it and not really thinking about it. But then as the more time you spend and you're creating this whole new crisis diversion, you really realize, and you look at the numbers now, like 16,000 people that we've supported. Like, who would have thought that, that's something we could have done? And just and then when we read from those reports that, the Canadian Mental Health Association has put together, have put together, and you look at those reports and what the people that have actually used the service, what they're saying. I mean, it's very, it's something that I would have to say is very, for me personally, I'm really proud of this initiative. And I think it's just been a really humbling experience for me personally. I think it's one of the best initiatives that I've been involved with in my career.
This is a really it's a big question. I think I would definitely echo a lot of Angela's sentiments, especially around that word humbling. I think like as a policy nerd, the ability to get to be involved in something that change something in the city policy and in all of us in our own small ways that we're able to impact that is very humbling. It's absolutely a dream to be able to get to be a part of something like that. So I would say, yeah, this is a truly incredible project to get to be a part of. So I just feel, yeah, grateful and humble feels like the words because those opportunities they don't present themselves all the time. And we're really in a privileged position to get to be a part of that conversation and a part of that change. So yeah, I will leave it at that.
And a question has come up in the chat here. So maybe Sarah and Angela, if you both want to answer, what is some of the feedback that you've heard from the people that have been supported through the TCCS in Toronto and through the partnership in Calgary?
I think, so for the TCCS, I think some of the feedback that we're hearing is really how this approach, I don't want to use the word humane, but really that's what it comes down to is when you have a police-led response, there's a lot of intimidation, there's a lot of fear. And also people feel more vulnerable. And sometimes people don't want that response, right? There's shame attached to having police come to your home. So the fact that the crisis team will meet you where you want to be met, they'll meet you at a coffee shop. They do, the way they just come to you and the way that it's led, it's just the whole community-led response really makes it more personable. It makes it easier for people to connect and then ask, that whole follow-up wraparound piece where, they'll tell you that if you need more support, please don't hesitate to call. It's really bringing that. So from the feedback here in Toronto, it's been really about the people feel that they're being supported with dignity and respect. And that's the biggest piece, and that they meet them where they're at.
Thanks, Angela. Yeah, in terms of our 211 response, it is really always exciting to hear people that didn't know about 211 or didn't know about these services, didn't know about all of their options. We are in a really privileged position to be taking the calls from 911 where folks are not sure where to call, so they're calling because they just don't know. And we're getting to give people that agency to have a little bit more of control over the type of response that they get, and also having that follow-up capacity to go and check on people and make sure that they are getting what they need. So I think that education component that comes out of this support and the ability for people to have a little bit more choice has been really powerful. And then I'll share one anecdote about some feedback that we got about a mobile team response that was transferred over from 911. They were calling because there were some folks staying in the laneway behind somebody's business. The person was a little bit concerned about them, wasn't sure who to call, called into non-emerge, we ended up connecting them with our mobile team. And we got a voicemail about um, the respect and dignity that business owner saw the team treating people with and how grateful they were, also how knowledgeable the team was, and also that the team took the time to come and connect with that business owner to say, hey, if this happens again, here's kind of destigmatizing some of that, what that interaction could look like if he were to just go chat with the folks that were staying behind the building, and how appreciated that was about the tools that were given to him in that response, as well as the way everybody was treated with so much care and dignity. So that was a nice one.
Thanks so much. And I see we've had John able to jump in. So John, maybe I will just If you can hear us, we can hear you. I'm going to hand it over to you for the last 7 minutes of the presentation, and maybe you could just provide an update on. We've heard a lot about Calgary, we've heard a lot about Toronto, and Ottawa's the newest to kind of jump into the fold of doing this work.
I misunderstood the time because I thought it was 2:45 Eastern time, and it's now 2:38 Eastern time according to me. But that doesn't matter. Thank you, and I apologize for not being on at the correct time, but I'm on holidays, so maybe that gives me a little bit of wiggle room on not being in too much trouble with you, Robin. In any event, let me just say the timing is excellent in terms of the time that to talk about this. I just got some stats before I left on holidays, and we started live with community crisis response on August 15th, so just over a month and 40 days, and we've had more than 700 anchor calls as calls for community crisis response, and have dispatched over 300 times. So it's been incredibly successful. This is a project, folks, in Centertown of Ottawa. It's in the downtown core, and it has been very interestingly, Sarah, with the story you just related. That's the kind of feedback we've been getting. But we've also had a problem, which I would share with people going forward, is in expectations. We were supposed to do a soft launch on August 15th, but the media did get involved and there was some publicity. And in Toronto, they started just with the 911 calls. We started with 911 and 211 as well, to coming to the 211 number. And individual businesses and residents there's a huge epidemic of open drug use on the streets in Centertown, a big problem with homelessness. They put a new police station in the Byward Market, which is just east of the Centertown, and all the people have moved over to Centertown. So all these people were calling, expecting that we were going to send people to get somebody that was trespassing on their lawn or move them along on the sidewalk. So we have some work to do in the next several months to clarify what the role is, what the public is expecting. Otherwise, of course, it affects the 211 reputation when people are unhappy because they didn't get the result they expected when they called 211. The other thing I would say, Robin, and to everybody listening, building trust amongst the different players is really important. Robin, you mentioned that to me when you were first starting out, that was an issue that you had to cope with. We've been very fortunate. The Ottawa Police Service, their director of the comm center, has been hugely supportive. So we've had over 200, about 150 calls directed from 911 in the first 40 days. We all work closely together. When we were a sole source to do the dispatch, and then the community health centers were announced that they were going to be delivering the actual mobile service, I didn't know either of the executive directors. I called them immediately. I went and met with them in person and said, look, I don't know a lot about some of the work that you do. I need your help. And we've become very, very collegial, very collaborative, and it's made all the difference in the world in dealing with the challenges we had in the few days with different things going wrong, solving those problems together. So building that team, if you're going to be doing a project with your partners, and building that level of trust where you can have frank discussions, really makes it a lot easier. And that's the reason I think, even though we were swamped with probably 8 times the number of calls we expected in the first 4 or 5 days, we managed it all together to actually respond pretty well in circumstances we weren't expecting. So those are few of my high points. I have more, but I'll stop there, Robin.
Awesome. Thanks so much, John. What a way to kind of wrap it up, to show some of what's been going on for a little while, and how fast this work is starting to build, and how fast it can happen when we start to roll something out. So I hope everybody was able to learn something a little bit new today, really identify ways that we can partner and work together across systems differently, but also across partners across our country. And I think for me, that's one of the things that's really special about Inform Canada, and these opportunities to come together with partners from coast to coast to learn, to share, and to see how we can just continue to evolve in how we serve community in I&R. And I see John has one more thing wants to add in.
Robin, I can't, after you suggest this, we would not have pulled this off without Angela Finteri, Sue Wilkinson, and the team at Find Help. I stole everything they did from writing my proposal, and they were there. They helped us with the training. So that's an example. I'm saying what you're just saying, Robin. That's why I wanted to mention it. We can all help each other. Nobody has to reinvent the wheel. Angela told me all the places they stubbed their toes, so we didn't stub our toes on those same things. And we're learning some new things as well. But I'm just saying that effort across the country, if you're going to get involved in this, you now got, 3 or 4 organizations that can just shovel the stuff to you, and you'll be off and running way ahead of where we were. But so I just want to again thank the team at Find Help, who have been incredibly collaborative, and we would never ever have pulled this off without their help. So thank you, Find Help, and thank you, Angela.
Well, thank you, everyone. The next session, I believe, Andrew, correct me if I'm wrong, is also in the Zoom platform. And that's where we have one of our amazing colleagues from Inform USA with us to talk about all things standards. Awesome. So in Zoom in 15 minutes. So that gives everyone a moment to get up, stretch, don't fall asleep at your computer. Those things are really important. And thank you so much, everyone, for joining in the crisis diversion presentation today.